Hi, I'm Dan Costa, Editor-in-Chief and Chief Content Officer of Worth Media Group, and I'm here at the Lake Nona Impact Forum. We're talking about the innovations that are happening in the healthcare industry, and we have a very special guest with us today. Dr. Patrice Harris, thank you so much for coming by. You are the co-founder and CEO of eMed and the Medical Editor-in-Chief at Large for Everyday Health, a site that I am very familiar with, being a former Ziff employee. Thanks so much for stopping by.
Well, thank you for having me.
So this is your third time at Lake Nona?
This is my third time.
Many of the people that come here say that this conference is different than a lot of other conferences, a lot of other medical conferences. What do you think makes this place special?
I think the size, the scope of the issues, and it really is about solving problems. It is very easy to continuously talk about the problems, but not the solutions. And I think at Lake Nona, there's an opportunity for discussion and networking, but people getting together to really solve problems.
You are the founder and CEO of eMed. This is a company that you founded in 2020. That was an interesting time to be in the medical industry. Tell me a little bit about the company, its mission, and how it operates.
Well, another hat that I wear is that, especially in 2020, I was the president of the American Medical Association at the very beginning of COVID. And of course, I saw all of the issues that were bubbling up to the surface, had always been there, that were bubbling up to the surface. And clearly issues around people having equitable access to testing was huge. And about that same time, and so it's all those issues, and I was talking about those issues, and about that same time I was approached to be an advisor. Folks are putting together this company, would you be an advisor? We want to use technology to solve problems. Dr. Harris, we've heard you talk about the fact that it is important that technology not just be about creating a shiny new object, but solving problems. And so they brought me on as an advisor. And after the very first meeting, I was saying, this is great, but there's a problem we have to solve right now. And so to make a longer story short, they liked my vision. They knew that I was committed to using technology and could bridge the gap between healthcare, medicine, and technology. Mm-hmm. And we started eMed, and we were thinking about longer term, right? Diagnostics at home. But again, the problem at the moment was getting folks access to COVID testing. So we said, let's develop a platform where people could test at home, the convenience of their homes 24/7, but with some confidence. We have a proctor. So that's what other people did not have.
That managed the test.
Yes,
virtually.
To made sure that the proctors made sure that even you opened the box correctly and the test wasn't expired, walked you through the test, because I can tell you, the very first time I took the test, I performed it incorrectly.
Yeah.
So that was that peace of mind for the person taking the test, but also peace of mind for the doctor who might be reviewing that result and then making a recommendation regarding treatment. So COVID-19, though, was our proof point, not our end point. And so we are looking we just launched an urgent care kit. People at home, it's like a first aid kit. You want these tests in your home. And then once you get a positive or negative result, but once you get a result, then you can work with your healthcare provider, or we can connect you directly to someone. And so that's why I'm so excited about what we did at eMed and what we plan to do in the future.
So interesting, hearing you describe the testing process. Like, now there's testing, you can get it at any street corner, you can get a kit. We've all taken multiple COVID tests. Back when it started and those first few went out, being alone in the bathroom with the door closed and looking at this thing and trying to read the instructions and feeling so much weight that you're going to get it wrong.
Yes.
I can imagine, it would have been nice to just be able to say, am I doing this right, to someone?
Absolutely, and as you just noted at the very beginning, the stakes were higher, right? Because if you were positive, what do you do? And at the time, I remember at the very beginning, we didn't have treatment. We do now, thankfully, but people have told us that they got great peace of mind. And you talked about WEIGHT, W-E-I-G-H-T, of doing it right, but it's also solving a problem for the other weight, W-A-I-T. Right. You didn't have to wait. It was immediately, now once you receive the test, and we believe, again, the first aid model, you have these tests in your home, but even as people were getting our tests, they were there, we delivered them within 24 hours.
So what's next? COVID's pretty clean. What other applications are you going to develop?
So COVID flu was just, and by the way, let me just make sure, EMED, because a lot of people confuse this, we are not a test manufacturer. It's the tech platform. We are agnostic as long as your test works, is approved by the FDA, affordable and easy to use. We will be there for that peace of mind. And so we're thinking about, and again, just launched COVID flu, strep, and UTI. So the possibilities are not endless, but the possibilities are great, solving, again, some challenges, because we know the quicker you get your diagnosis, the earlier you get treatment, and this is across the range, but of course we were talking about what you can do at home, the better your health outcomes, which is better for all of us.
So part of what's driving this ability is obviously broadband, people having connections. Can you talk a little bit about how 5G and connected healthcare is sort of changing the industry?
It's critical. I'm originally from West Virginia, and of course COVID, again, another issue that it brought to the fore was when we had to quickly move to telemedicine and teleeducation. Not everyone had broadband access. So that is so critical. We have to be about the business of creating that infrastructure so everyone can, and then they can have access to teleeducation as needed. By the way, listen, I'm a child psychiatrist and want kids to be in school and that socialization, but certainly there are so many other opportunities. Can we connect them? We had a great presentation at Lake Nona about Sesame Street. And I can tell you that during the pandemic, when parents would ask me, where do I go for this information? I say, go to Sesame Street. They had a lot of information on mental health and kids coping with this pandemic. But in order to do that, we have to have 5G. We have to have the broadband infrastructure. So like anything else today, it's interconnected. And we have to have the 5G, the broadband infrastructure as a foundation.
So back in 2020, it was sort of an emergency situation. The regulators were sort of taking a hands-off approach, just try to help as many people as possible. If you have to do it remote, most people had to do it remotely. We're going to look the other way. Do you see any of that being rolled back now that we're on the other side of the pandemic? Is it going to be harder to deliver healthcare virtually?
Some of it is getting rolled back. And as I said during the time, listen, we needed these emergency relaxation of the regulations. But I also said what we should be doing is being thoughtful going forward, right? And so I'm certain there are regulations, I know there are regulations that need to continue, but there are many that, need to remain in, I guess, as they were in the public health emergency. So I think it's going to be a period over the next couple of years of figuring it out. At the end of the day, though, here's what I want to make sure we do is base these decisions on evidence and data, right? What worked and what didn't, not your opinion or my opinion, but what really worked. And when I talk about I talk about, did it deliver care? Because at the end of the day, particularly those of us in healthcare, but really all of us, it's about, did we improve lives? Did we deliver better care? And we know that telehealth is a critical piece of the puzzle. It's not a one-size-fits-all. Although at some day, maybe in the year 2100, we might be able to do some of the things. But right now, there are things you still need to go in for. But it's figuring out the ecosystem, and clearly innovation, technology, telehealth, and a regulatory framework needs to catch up and modernize so that we can make this progress.
Is there anything that you've seen or heard at the conference that you didn't know before that was like news to you?
Well, I have to tell you, I just moderated a panel, and we were talking about drug pricing. And I'm so excited about the innovation that's going on there. We really have to unpack all of the bureaucracy in our current health ecosystem, and there are some things we need to do differently. It's too, and listen, I will admit I'm a physician, right? But it's too many things, processes, people that are between a patient, between a doctor and a patient, but anyone and a patient. I don't want to be so doctor-centric, in getting good care. And it's not transparent. So I learned a lot about that, and I'm so happy.
It's interesting because it almost, you're suggesting there's systems that are broken here. The knee-jerk response, everybody blames the drug companies. Prices are too high, we blame the drug companies, and that's sort of the end of the discussion. But there's probably a little bit more nuance to the problem than that, and other ways to address it.
You know, and I use the term nuanced in my introduction because these problems are difficult. If they were easy, you know, it's almost cliche. Someone would have solved these problems, right? Because we spend a lot of money in healthcare and we don't get the outcomes that we want. But they do require nuanced discussions. And I talk to young people a lot. I get invited and get the wonderful privilege of speaking at commencement and some other activities. And here's a new habit we should develop, and that is certainly we are going to have that knee-jerk reaction. So it's futile to say, don't have your knee-jerk reaction. Have your knee-jerk reaction, but commit to taking a moment, thinking about it, and having a second reaction. And you're right, blaming and shaming. Listen, there's blame to go around. And I have to say, there are perhaps some folks that are not adding any value, but just the knee-jerk blaming is not where we need to go. We need to have nuanced discussion. And the exciting thing about so many people here at Lake Nona is they are willing to innovate to solve problems.
Dr. Harris, thanks so much for taking the time to talk to us. I look forward to continuing these nuanced conversations in the future. We'll carry on in the future.
Well, thank you for the opportunity.
Thanks so much. If you want to hear more about these stories, check out worth.com.